Hello, this is Dr. Eric Bricker, and thank you for watching AHealthcareZ. Today's topic is what a hospital CEO should do. Now, this is probably the most presumptuous video that I have ever made, but I'm gonna do it anyway. Now, pain causes change. And that's a quote from Stephen Covey, and I love so much of Stephen Covey's work. He has passed away, but from 7 Habits of Highly Effective People, etc. So, if we're going to talk about change in healthcare, well, in the current pain of coronavirus, both from hospitals that are actually dealing with coronavirus, and two, from the financial pain from decreased patient volume that we've talked about so much, there's quite a bit of pain right now for hospital systems. So what kind of changes should be put in place? Here are my ideas around that, and it's really a synthesis of 4 changes and what order they should occur in based upon my previous videos, and I will leave a link to those previous videos in the show notes. So, they fall into 2 categories, operational changes and financial changes, and then things that should be done first and things that should be done second. Now, I believe the operational and the financial changes can be done in parallel because they're largely going to be done by separate people and parts of the hospital. So the first 2 things that can be done in parallel are, 1, operationally, would to put in a quality improvement course. This comes from Dr. Brent James from the Intermountain Healthcare System, where he said the very first thing he would do to improve quality at a hospital would be to put in a quality improvement training course first, so that everyone, whether it be the nurses, the respiratory therapists, the doctors, etc., they can all speak the same language when it comes to quality improvement, because they're the frontline workers. They see the patients on a daily basis, and they're the ones that frankly will have the best ideas about quality improvement, but they don't know how to do it, and they don't know how to talk to each other effectively because they've never gone through a quality improvement training course. And so that is the basis for the change. It's also the basis for the change because quality and the patient and doing what is best for the patient comes first. Okay, likewise, what can occur simultaneously is to put in is to put in a cost accounting system, as I explained in the video from the University of Pittsburgh Medical Center. And this also is incredibly important because it will provide the financial tie and the financial measurement around the quality improvement changes that are occurring. And they can really occur, in my opinion, in parallel at the same time. And I'm going to say a year for both of these to get in place. You know, could it be at 6 months? Could it be 2 years? Sure. But we need to have reasonable progress in reasonable time. Okay, next up. The second batch of things I would do would be to put in a digital command center, for, as is explained by GE and what they put in at Johns Hopkins Hospital, because of all of the complexity and lack of coordination problems that hospitals have, both within the hospital and across facilities. Think about it. You could not only do it for within the hospital, but you could do it between various ambulatory clinics in the hospital as well, and you can integrate all that with the command center. Now, what the command center will do is it will highlight and it will point out problems or breakdowns in patient care. And so it needs to occur after the quality improvement course, because this is the why part down here, because you have to prep the staff for the command center challenges that they're going to see. So in other words, they're going to see patient problems, they're going to see crowded waiting rooms, they're going to see supply chain breakdowns, and there needs to be this baseline in place in terms of quality improvement to be able to fix those problems. Otherwise, if you put in the command center without the ability to fix the problem, all you're going to do is be like, look, we got a really full waiting room, or look, we've run out of supplies, or look, we've had bad patient outcomes, and then you won't necessarily know how to fix it. Okay, next up, the second thing to do, which can occur again in parallel to the command center, is to start a health plan, as in what they did at Intermountain Healthcare and Geisinger and UPMC as well. Now, the reason that starting a health plan has to be done after the cost accounting system is because you need the cost accounting system to know what a knee replacement actually costs you, to know what a gallbladder surgery actually costs you, to know what a 5-day hospital stay for pneumonia actually costs you. And so you can model and then subsequently reduce expenses in order for this health plan to actually appropriate set the premiums, right? Because of course the huge challenge on the health plan side is to set the premium high enough to cover your cost in the patient care. And then you can lower the patient care, and then over time you can then lower the premium, keeping whatever margin margin there is between the patient care costs and the premium, and then you can be more cost competitive against traditional commercial insurance carriers because of these efficiencies that you've done. And the internal efficiencies that a hospital-run health plan would get would run circles, if done effectively, would run circles around a commercial health plan in regards to the premium that they could charge. It would be so much lower than a commercial health plan premium. It's unreal. Okay, and again, this can be done in parallel with the command center. So again, I'll put this at another year here, and I'll put this at another year here. So I'm not saying 6 months, I'm not saying a decade, right? So I'm saying 2 years to get all this at least underway. Now, of course, there's going to be a gazillion different tweaks. And my rationale for that timeline is if you look back at what the United States had to do during World War II, I mean, we could crank out a ship incredibly fast, like with no computers. And the point is that if we could totally rearrange organizations and like change a factory from building cars to building airplanes back in the 1940s, we can do this today. We can do it. And that's my point for today. And thank you for watching AHealthcareZ.